Hello, this is Dr. Robert Cywes. I am an MD Ph.D. currently in clinical practice in Florida in both West Palm Beach, and I have an office in Jacksonville. I'm very thankful for Jim Greenblatt's invitation today to present our basically ideas and concepts from our practice of therapeutic strategies in terms of treating obesity, diabetes, metabolic syndrome, using more of an addiction perspective rather than a dietary perspective. I'm about as far removed from psychiatry as a healthcare professional can be, in that I'm a general surgeon and a pediatric surgeon. And as part of the story, I'll talk to you about how this concept evolved. So please understand that I'm going to tell a story that will resonate very heavily with your training, your scientific background, as well as your clinical background, and just resonate with you as a human being. But what I'm going to be talking about is our observations and really thread a story rather than give you peer-reviewed data, although it is all based upon science that will be familiar with you, even though you may argue with some of it. My job today is to make you think differently about a subject that we really don't have very many answers for in a sustainable way. The other, just on this front page, I'd like to talk about is that we are a group of kind of disparate people that are low carbohydrate advocates for a variety of different reasons. But over the last 2 to 3 years, we've become collective in a society of metabolic health practitioners that was launched a few years ago. And if you are interested in practicing in this space, I would urge you to sign up and join us. Collectively, we have a much, much louder voice than just grains of sand on a beach. So one of the observations that we can look at is that most of the time when patients come to you, they have metabolic disease, they have diabetes, they have obesity, they have mental health disease. But none of these, while we may be experts at treating these, none of these are problems. They are consequences. They are consequences. And if we treat the consequences of certain disease pathways without understanding and effectively treating the root cause, we really aren't effectively going to eradicate the problem, and it's going to be chronic and relapsing. But currently, both in healthcare as well as in society, we're obsessed with eating healthy, and it's veganism, no, it's carnivore, no, it's keto, no, it's fasting, no, it's a balanced diet. And there really is no consensus or consistency, and therefore no strategic approach to helping our society to remedy this awful problem. We demonize carbohydrates, we demonize plants, we demonize animal products and red meat, we demonize saturated fat, and certainly industry is profiteering very, very heavily from this way of doing things. So because we really don't have a conceptual understanding of what the problems are, we all knee-jerk into creating these ridiculous diets to treat the consequence of what is ultimately a very, very bad diet, which is the standard American diet. And despite applying a lot of science to this, all of these different approaches do not work. And I bet you every one of you buys into one of the little photographs on this slide. And yet none of them effectively work. Here's the proof. In 2005, Dansinger's group looked at the adherence and effectiveness of 4 popular diets. All had a lot of science-based evidence, and they were all stated as being the best diets out there. Atkins being a carbohydrate restriction diet, Ornish being fat restricted, Weight Watchers being caloric or energy restriction, and the Zone diet trying to find some macronutrient balance. But if you look at these diets that were supposed to be studied for 1 year, it's kind of pathetic that around 50 to 60% of people were only 50 to 60% of people were able to actually stick to the diet at 8 weeks, let alone 1 year. And the ultimate weight loss was pathetic. In fact, in my practice, we were dealing with enormously obese people. Weight loss of 5 to 7 pounds is really a bowel movement. That's not weight loss. So all of these diets, no matter how plausible and how wonderful the science behind them may seem, they all fail. They all fail. Everybody loses weight, but ultimately they all fail to keep the weight off. And we have to understand why, and we have to look at why. Because, you see, currently we're imprisoned by our own cognitive dissonance of the problem. We're trapped in some scientific theory of either it's carbohydrate, insulin, glucose, or it's the lipid heart biology. We're obsessed with eating healthy. This thing's good for you, this thing's good for you, this thing deals with this thing. And we're obsessed with using what we eat to treat problems. It doesn't work that way. And we've slowly developed over the last 50 to 70 years into a highly lipophobic society that is intensely carbophilic. In fact, we started in the 1950s and 60s when we absolved nicotine of causing heart attacks and strokes, and we blamed saturated fat for clogging our blood vessels. That's the state of our cognitive dissonance, and as everybody knows, we absolved nicotine into the 70s and 80s, and millions of people died because of that erroneous assumption that fat was to blame. But now we're demonizing carbohydrates, and the bizarre part is that we blame the diseases that we have for the diseases that we have. So the mindset of the majority of people out there, including most healthcare workers, is that obesity causes hypertension, obesity causes cardiovascular disease, obesity causes obesity. Obesity doesn't cause anything. The only two things obesity really causes is it causes our hips, our knees, our ankles, our backs, our weight-bearing joints to hurt. And most obese people don't look so good in a thong. But other than that, obesity per se does not cause significant health problems. And the reason for that is because obesity is not a causative problem. Obesity is a consequence. But you see, we look at what we see. We look at what we see, whether that's fat clogging our blood vessels or obesity or diabetes. And we never look at why. Why did we become fat? Why do we have diabetes? And we never ever consider obesity in any other form than a disease. It is an entity. But the reality is obesity is a lifestyle. It is a way of life. And unless we address the way of life, you really cannot outsource through medication or through surgery a lifestyle disease. We cannot medicate and operate on something we do to ourselves. These therapies, these treatments slow down disease, transiently correct them, but does not interfere ultimately with the progression or the consequence. All right, folks, let's take a deep breath. What we have to understand is that diets by definition treat the consequence, not the cause of metabolic disease, diabetes, or obesity. And I'm going to make a categorical statement, and then the rest of this discussion is going to be in support of this categorical statement. Metabolic disease, diabetes, and obesity, root cause has little or nothing to do with diet or food. It is not a nutrition problem. It is not a calorie problem. The root cause of metabolic disease, diabetes, and obesity is a comprehensively deficient emotion management system that has been replaced as a surrogate with a highly dysfunctional emotion management system. In other words, the root cause of obesity is a substance abuse problem, an addiction, not a nutrition problem. Now, let's dive into that. Every day, every human being experiences emotional tension, anxiety, stress, depression, anger, fear, frustration, sadness, exhaustion, boredom, and pleasure, collectively called emotional tension, and we all experience it. And all human beings throughout the day have a variety of strategies that we use to dissipate that emotional tension. The way the human brain works is a little bit like driving in the rain. You're driving in the rain, you're working really hard, and that rain is falling on the windshield, and eventually you get to a point where you can no longer see through the windshield, and you hit the windshield wiper, and it takes a second and it clears the rain off, and then you drive in the rain again and it refloods the windshield, and you hit the windshield wiper again. In exactly the same way, a productive day for a human being works the same way in the brain. We're focused on what we're doing. We're building up neurochemical tension in our cells. And then we need to trigger a chemical relief. Now, when I'm talking about dopamine and serotonin, it's more by concept than by particular molecule level. But when we're focused and concentrating, we're loading with dopamine, and then we need that brief moment of serotonin relief, that window washer, to give us emotional relief from that tension. I call that relief a little mind cleansing moment. And every human being utilizes a variety of unique strategies to activate the endorphin system massively or in small forms as our dominant form of serotonin relief. And every human being has a variety of different ways that we give ourselves that emotional reprieve, but every one of us has a dominant one. And we are defined as individuals by the dominant thing that we do for endorphin system activation as that mind cleansing moment. Now, when it comes to emotion management systems, I've categorized two separate forms of emotion management. The first one I've called an effort-based emotion management system, and it is the one that all people, the majority of young children, are exposed to at the beginning of their life. In an effort-based system, let me give you an example. Let's say I come home tonight and I've had a big fight with someone, I'm all angry and upset and stressed out, and I leash up my dog and we go for a walk. Physical activity is a wonderful endorphin activator. It's a very powerful endorphin activator, but it does so gradually over time. So while I'm out there walking and the speed of my walk, the distance, the productivity of the walk is not important. As I'm walking, my emotional tension slowly dissipates. The world dissolves around me. And I kind of get into a meditative state where the issues of the day that have been shoved into my subconscious to deal with, they now percolate up to the top in that relaxed state, and I can connect with and process and deal with or let go or come up with a game plan of how I'm going to handle certain stressful things that have occurred that have activated my stress or my anxiety. So by the time I come back from that walk, number one, I'm emotionally relaxed. Number two is I've got a game plan for dealing with certain issues that triggered the emotion. And the most important part of that walk is if I have unconditional pride in the effort that I assign to that walk, irrespective of how long or how far or how fast the walk was, that unconditional pride in the effort, in tiny little increments, builds up my self-esteem, my self-confidence, and my self-respect. And I am now validating from within myself that I'm a good person, that I approve of what I've done. And I can then set up an effort-based system because of that approval as a desirable thing that I practice more and more often until it becomes part of the foundation of who I am as a human being. And an effort-based emotion management system has several pillars to it. The first one we've just described is physical activity, different from exercise. Could be exercise, but it's really about physical activity. The second one is a broad category of creative arts. Reading, writing, music, fashion, art, sculpture, photography, rebuilding cars' engines, gardening, cooking, anything creative that becomes a fortress of solitude where we can go to relax, escape from the tensions of our world, but also connect with and process in that meditative space issues that we can then become proud of handling. The next pillar is meditation and spirituality. And spirituality is not just church and Bible. It's more a connection with a higher power. Man, I've had a rough day today. I need some guidance. Or look at what I'm really proud of. It's a conversation with a higher power that we're not ready to have with other human beings yet. Or it may just be straight meditation. Human connection is another vital form of effort-based emotion management. Human connection, most people think they're pretty good at it, but human connection requires two things. Implicit trust in the person that you're with, that they will not be judgmental or critical of us, but they will potentially give us feedback or allow us to sort through things. And once we implicitly trust something, which is very difficult for most of us to do because we're afraid of being judged and being found not worthy. But if we trust somebody implicitly, we then have to take the risk of being vulnerable, of exposing vulnerability within that relationship, of speaking about and sharing things we're ashamed of or insecure about, with a purpose not of being condemned for them, but sorting through them. So, for example, something that most of you are going to be familiar with is therapy. Well, ultimately, what therapy represents for most people, in the conventional sense, is that pillar of human connection, because we trust our therapist implicitly. That's the principle of therapy, so that we can be vulnerable within that therapy session where we're not comfortable doing so outside. Healthy sexuality is a wonderful form of an effort-based emotional reprieve. And then we can certainly use certain substances and other behaviors as part of a diversity. And if we engage in an effort-based system, it is by far the healthiest emotion management system that requires us to assign effort up front, insert meditative time, and have that reward of pride on the back end that builds a sense of self. An effort-based system, folks, is very, very rare in terms of creating a vulnerability to addictive behavior. However, the second form of emotion management is called an instant gratification system. And there are two parts to an instant gratification system. The first part is the use of endorphin activating substances and drugs for that instant upfront, wonderful big burst of emotional reprieve, emotional obliteration. So let's say I come home tonight, I've had a really rough day, and I smoke 3 cigarettes. That nicotine is a very powerful upfront drug. As soon as the nicotine gets into my blood system, goes to my head, gives me instant gratification, instant tranquility, instant relaxation from the emotional tension. But because it's short-lived, on the back end of that nicotine, there's a degree of subconscious negativity, guilt, remorse, that in fact is very erosive to self-esteem, self-confidence, and self-respect. Secondly, because the effect is dedicated toward the obliteration of the instant emotional tension, it disconnects us from identifying and dealing with the issues that cause the anxiety or the stress. So I take that issue, that fight that I had with someone today, and I shove it in my subconscious. I'll deal with you later. I don't have the capacity to deal with emotionally traumatic issues. So I shove it in my subconscious. I'll deal with you later. And the term that I've coined for that is psychologic hoarding. So that our brains over time look like a hoarder's house, where these piles of unresolved emotional issues, and then these pathways that we can navigate through our brain from substance to substance to substance. And the final piece of instant gratification, that when that relationship with the substance is used to excess, the biologic harm, the physiologic harm, is specific to the drug. Nicotine over time causes or results in cardiovascular disease, lung disease, cancer. Alcohol, DUIs, liver disease. Heroin, you're turning blue and dying. Every drug has a specific outcome, but the outcome is not the problem, it's the consequence. The root cause is chronic excessive use of an instant gratification drug for emotional relief. And everybody understands heroin, crystal meth, crack cocaine, nicotine, alcohol, vaping. We understand those, and we categorize them very easily into addictive substances. The place where our society hasn't yet come to terms with the most prevalent, in my opinion, the most toxic, ubiquitously available drug in our current society is, in fact, sugar and starch carbohydrates. Not food, but sugar and starch and carbohydrates as a primary endorphin activating substance that most of us use for that instant relief. But when it's excessively used, it causes the harm of metabolic disease, obesity, and diabetes. Now, while we're on the subject of instant gratification, there is a second, less focused on form of instant gratification, and that is what I call process addiction. And the obvious ones there are gambling, sex, pornography, cutting, where you're intentionally hurting yourself for that bizarre pleasure, procrastination, screen time, social media, gambling. But there's also anger, yelling, shouting, physical violence, physical aggression, disruptive behavior that we see in healthcare such a lot, especially in my group of people, surgeons. There is spousal abuse. But when it pertains to eating and drinking, a snack is always, always, always an emotional event. It may be a carbohydrate, but even pepperoni and cheese as a source of emotional reprieve are calories for your head, not for your body. And then just like cutting, hurting yourself is a source of emotional reprieve in a very weird way. There's a term that I've coined called Rottweiler syndrome, which is where we overeat. We eat like a Rottweiler having breakfast very fast, aggressively, and overeat. Oh my God, I'm stuffed. Well, that painful feeling of overeating in a bizarre way has a sense of emotional restitution, just like cutting has. So a snack, which so many people advocate, oh, you must have a snack. A snack, folks, is always, 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 always an emotional event in exactly the same way that a cigarette is always, always, always an emotional event. So nearly every child is raised with exposure to both emotion management systems, instant gratification and effort-based. Some are raised in a way that incorporates a diverse effort-based system as a fundamental foundation of who we are as human beings. And those people, those kids become emotionally healthy, confident adults. However, for reasons we're about to explore, some folks are unable to incorporate an effort-based system into their foundation of their way of life, and therefore they default, with that comprehensive absence of an effort-based emotion management system, they default to an instant gratification system as they get exposed to it. Vaping or nicotine as middle school kids, carbohydrates as young children that are fed to our kids by Gerber. It's the mac and cheese, it's the applesauce, it's the Cheerios, it's the goldfish. It's the orange juice. These children have a vulnerability to addictive behavior when they are unable to incorporate an effort-based system in their way of life. And then the addictive behavior is to the prevalent drug in our society. So let's look at how a healthy effort-based lifestyle works. Well, the things that generate emotional tension are what we do for work. Success, productivity, hard work, achievement, perfectionism, control, wealth, power, all the things we do as part of our way of life, the things that we have to do, all generate productivity, generates emotional tension. Productivity, our day-to-day, and things that come at us intentionally or unintentionally, unexpectedly, generate stress, anxiety, frustration, depression, sadness, anger, exhaustion, boredom, and pleasure, emotional tension. And all human beings that are productive have a variety of the effort-based systems that we just discussed as a way to offset against the emotional tension that comes from productivity. So effective productivity requires equal and opposite forms of emotional buoyancy. And healthy people have diverse, effective, effort-based emotion management systems that require time and require effort to dissipate emotional tension. So often, though, we're so busy working really hard that we slice away the time and the effort required to invest in a healthy emotion management system. It's that yin and yang, where on one side you've got productivity, on the other side we've got self-care. So what happens is we sacrifice self-care. And when we sacrifice self-care comprehensively, it leads as a surrogate to addiction as a lifestyle. Now, instead of the things that we have to do being part of productivity, they become part of stress loading. And we focus on things that happen to us about, oh my God, this is happening. Oh my God, that's happening. And we focus intensely on the causes of stress. that then justifies and validates an instant gratification relationship with carbohydrates, with snacking, that over time becomes a justifiable lifestyle to give us that instant gratification, that instant obliteration and resolution of emotional tension. And gradually, as we develop that instant gratification relationship as a surrogate for an effort-based system, we begin to distort over time the reality of the harm, because as we become more and more frequent users of carbohydrates and snacking as a way of life, as this becomes who we are, slowly over time, not immediately, bad things begin to happen. We start gaining weight, we become insulin resistant, we may become diabetic, we may start getting cardiovascular disease, we may be getting polycystic ovarian syndrome. There are a variety of different diseases that come out of chronic excessive carbohydrate consumption. But because they're insidious, we become very effective at distorting the reality of that harm to continue the relationship. But along the way, because we do not have effort-based systems that we can be proud of, our self-esteem, our self-confidence, our self-respect dips down to the toilet. Now we're angry, stressed, anxious, frustrated, exhausted, and we go and see the doctor. And what does the doctor do? They see the obesity, so they put us on a diet, drink less Coke, exercise more. They see the anxiety, the stress, the depression, and they throw us on psychotropic antidepressant medications. If our emotional relief, our instant gratification involves some of the process addictions, then we're ending up with disruptive behavior, we're ending up with obsessive compulsive behavior, we're ending up with PTSD, we're ending up with suicide. Those are all consequences of inadequate mechanisms to manage what life is throwing at us. And that system becomes completely out of control, and we develop carbohydrate addiction. And what's feeding the carbohydrate addiction is this obsession with the standard American diet, this grain-based, carbohydrate-based, plant-based, sugar-based diet as being so healthy for us. Well, if I told you you had to drink 3 whiskeys with every meal, how can you not be an alcoholic? And therein lies the challenge. Just like in the old days, we told people cigarettes were just fine to smoke. Now we know differently. We keep telling people to eat healthy grains, healthy fruits, healthy vegetables, and healthy snacks. If you look at this MRI of the brain, both sugar and cocaine, in fact, sugar more brightly, lights up the same aspects of the brain, same anatomy of the brain. Tell me sugar isn't a drug. And what determines our vulnerability to addictive behavior? Well, it's the way we were raised. It's the way we were raised. It's our early childhood. And a large component of early childhood is parenting style. So when it comes to children, all children are exposed to the elements of an effort-based family plan. All children run around and play. All children learn to read and write and have creative exposure. All children have human connection. All children have forms of meditation or spirituality imposed upon them. Some incorporate that, others don't. The kids that are not able to incorporate an effort-based system as part of the foundation of their way of life are kids who are raised in an authoritarian family or a permissive family. Authoritarian family sets, the parents want the child to do really well, but the way they do it is to set ridiculously lofty expectations of those children. So no matter how much effort the child puts in, there's always an expectation that is beyond the capacity of that child to do. So they put a lot of effort in. They don't have any issue with putting effort in. But instead of feeling wonderful about the effort that they did do, they feel terrible because they didn't meet some ridiculous metric where the parent is trying to get the child to improve, but the child sees criticism and a sense of failure and a sense of not being good enough that then becomes erosive to the self-esteem they should have on the effort, irrespective of the outcome, because the outcome is more important than the effort. They can't self-approve. So they externalize their locus of validation, and they're performing for everybody else around them with a hope that they will unconditionally approve, but they never do. Look, Mom, I scored an A on my math test. That's great, but Why didn't you get an A+? What question did you get wrong? And who came first? Never good enough. You know what I'm talking about. And therefore, those kids learn to fill that void of emotional sanctity with some instant gratification substance that drives their self-esteem further into the toilet. The second category are kids that are raised in a permissive family. And kids that are raised in a permissive family have all the intent in the world to do something. Man, I've had a rough day. I'm going to take my dog for a walk. But just before I go, I'm going to have one little shot of whiskey to calm my nerves. And half an hour later, the bottle's empty. They passed out on the couch. The walk never happens. Or they buy the Peloton. Man, I'm going to get fit. I'm going to cycle on the Peloton. And on day 3, their ankle's hurting. My ankle's hurting. I'll do it again tomorrow. And tomorrow never comes. The sustainability isn't there. The sustainability, the effort isn't there. It's just so much easier to default to an instant gratification way of life. And they develop an absence of structure, an absence of commitment to the effort, and bounce through life from instant gratification system to instant gratification system, and a vulnerability to addictive behavior. Because they're unable, either authoritarian or permissive, to utilize an effort-based system. So they need to get high for self-care rather than self-approving. And there's actually erosion of that sense of self. Those folks that have a vulnerability to addictive behavior tend to see problems and tend to be problematic in terms of enhancing issues. This thing's happening to me, that thing happened to me. There's negativity and there's a problematic approach to life with an external locus of validation. Everybody uses instant gratification mechanisms. But if you have a deficit of an effort-based system, or you lose your effort-based system, you now start to abuse instant gratification, and over time you lose control and it becomes an addiction. On the other side of addiction, we see obsessive compulsive behavior as the nth degree of addiction, and then further down that road, PTSD is the next step across, where we just don't have the capacity to generate emotional well-being in the face of overwhelming emotional trauma. The problem is not the emotional trauma. The problem is the lack of tools in our toolkit to handle it. And the ultimate dysfunction is suicide. And we're seeing that more and more and more and more than any of our society will recognize. On the other side, we've got kids who are raised in an authoritative family setting, where the kid is allowed to learn within boundaries, not taught, where the kid is encouraged to do, but not to achieve. The result is of value, but it's not crucial. The effort is. And these kids, within the boundaries that the parents set very rigid boundaries, but a huge latitude of choice, of exploration, of learning within that. And they're always, always, always validating the effort, irrespective of the outcome. This is not everybody gets a trophy. This is hard work, but it's rewarding hard work. And healthy emotion management results and creates happiness with high levels of self-esteem, high levels of self-confidence, high levels of self-respect, and attached to that wonderful sense of self is a humility to the rest of the world because of an internal locus of validation. An effort-based self-care way of life that is based on putting effort in to create a meditative environment where those people, instead of being problematic, they're solutionistic. They have solutions. They create solutions. They have internal pride with empathy for others, and those are effective human beings. Now, the interesting thing is that the vulnerability to addictive behavior is not genetic. Oh, no, I know that's going to disturb a lot of people. It is not genetic. It is behavioral, but it crosses generations. Because the only way to raise a child is to be the person you want them to be. And all of us get raised a certain way, we become that person, and the best and only way we can raise our own kids, unless we change, is to raise our kids the way we were raised. So vulnerability to addictive behavior and an authoritative way of life crosses generations. The cycle can be broken, but it crosses generations. And it is very, very common for a couple to have one authoritarian and one permissive family member, one permissive parent, one authoritarian parent, and the child then falls in the cracks and goes one way or the other way. So you're not going to find this in any textbook, but my definition of addiction is chronic excessive use of an endorphin-releasing substance or behavior to the point of harm, ignoring and distorting the reality of that harm to continue the benefits of that relationship. When an alcoholic says, I need a drink, it has nothing to do with thirst or hydration. It has to do with emotional reprieve, emotional need. When a carboholic says, I'm hungry, it no longer has anything to do with nutrition or food. It's the same as saying, I need a cigarette. It's the carboholic saying, I need emotional reprieve. I get it from carbohydrates. I need a snack. I need to eat. Diets, even a low-carb, high-fat diet, modify weight. But only carbohydrate addiction management and a change away from instant gratification toward an effort-based lifestyle by removal and replacement can successfully, sustainably treat carbohydrate addiction. So let's break this down. Let's look at this a little further, just so that you can understand this. Everybody's going to understand this slide. We use salt and water. As human beings, we have to use salt. We have to use water for hydration. It is necessary for human survival. There's very tight biologic negative feedback control, and the quantity and frequency is regulated by a center in our brain called the thirst center. Nobody knows how much salt and water we need, but the body knows, and it will not allow us excess to harm under normal circumstances. So excess to harm when it comes to water is not possible under normal circumstances. On the other hand, let's look at another liquid. Let's look at alcohol. Alcohol is not used for hydration. Alcohol is a drug that is used to activate the endorphin center. Alcohol is not necessary for human survival. Alcohol consumption has a positive feedback loop. The more we drink, the more relaxed we get, the more buzzed we get. And quantity frequency control, the quantity and frequency of alcohol consumption is regulated by emotional need, not thirst. There's a powerful incentive to excess, which we have to internally control, and excess over time causes harm. Everybody knows that. Everybody understands that. Well, let's do exactly the same with all the food that human beings eat. When it comes to food, it's divided into two separate categories. Food is either nutritional, used as a building block and a repair mechanism and a growing mechanism for the human body, and that includes the macros of protein and fat. It includes the micros of fiber, minerals, vitamins, micronutrients, trace elements, and electrolytes. On the other side, we need energy, and requisite energy comes either from fat or from protein, the protein being turned to sugar by the liver. While sugar is necessary in the human body, it does not need to be consumed because fat and protein is adequate to provide both sugar and ketones or fat as a fuel source. Our food consumption, our nutrition, is controlled by the hunger center. Food is necessary for human survival. Without it, we will die. It is very tight. Our consumption is very tightly controlled in a negative feedback system where the quantity and frequency is regulated by a series of hormones that are triggered by saturated fat. 4 in the gut that we know of, 1 in the fat cells. What I call, and it's a phrase I've coined, is called the leptinoid hormonal system. Nobody knows how much we need to eat at any one time. So the whole concept of calorie consumption is ludicrous because it varies day to day and it varies based on our needs. Nobody knows, but the body does. Excess to the point of harm is not possible for normal human beings. Food will never, ever make us fat. It is impossible to get fat from eating food. It is the drug called carbohydrates that make us fat, sick, and dead. And I can be challenged on that anytime. Because carbohydrates are a drug. Sugar and starch primarily is used for the endorphin activating role. Carbohydrates are drugs not as they enter the mouth, but as sugar enters the bloodstream. Carbohydrate consumption is not necessary for human survival. There's a positive feedback loop, just like alcohol. The more we consume, the more relaxed we are, the more buzzed we get. The quantity and frequency is primarily regulated in an era of abundance by emotional need, not nutritional need. There's a powerful incentive to excess, and excess over time causes harm. How is that different from alcoholism that everybody sees as an addiction? Alcoholism is as much a hydration problem as carbohydrate addiction is a nutrition problem. And that is the strategic therapeutic change in your mindset. Because there is nothing essential about carbohydrates. They are primarily there in the modern era for pleasure and stress and emotion management, while proteins, certain proteins, are essential amino acids, certain fats are essential fatty acids that we have to consume. No carbohydrates, no carbohydrate addiction. So let's break this down, because why aren't carbohydrates food? Well, from an evolutionary perspective, yes, it is true for the majority of our existence, Homo sapiens have lived in an era or a state of nutritional scarcity and food insecurity. But over the last 50 to 70 years, for the first time, we are living in massive abundance. So when carbohydrates are considered to be food, they are a vehicle for nutrients. An apple, which is a pile of sugar, has some vitamins and minerals and fiber attached to it. So the sugar base is a vehicle for getting nutrients into us, but the sugar is not necessary. However, sugar does add a survival advantage from an energy perspective during scarcity, which is rare these days. Sugar easily becomes fat for storage, and peasant communities who are food insecure, whether that is urban peasant communities or rural peasant communities, we don't think of urban people as the poor, urban poor, as being peasant communities, but they are. That food insecurity is satisfied to a certain extent by carbohydrates. And in fact, at certain seasonal times, we can tolerate the harm of transient insulin resistance to accumulate fat from carbohydrates if they are seasonably available. In other words, if they are grown. When they're grown, they're environmentally regulated, and they do have a nutritional role, not an emotional role, because the reward when carbohydrate is a food is survival. But in the modern era of ubiquitous availability, let me tell you that most of you spend your entire life within 50 yards of an abundance of food. We are no longer living in a state of food scarcity. So carbohydrates are no longer essential for life, for survival. Secondly, the carbohydrate access has become globalized and manufactured. In the old days, apples were seasonal for a month or two. Now you can buy an apple 24/7 year-round because it gets shipped from all over the place. And then carbohydrates are manufactured and packaged to last forever. So we have this constant availability. There's enormous positive feedback when you're eating them for non-nutritional purposes because there is no homeostatic feedback. Excess, therefore, is possible. It is desired by certain people or at certain times, and chronic excess leads to harm desired by the brain. And that, in conjunction with the loss of multi-generational effort-based parenting systems, results in the use of carbohydrates as a drug for the high. See, humans converted to a plant-based diet because of food security, not nutritional value. In fact, we are human. We are human because of our brain, and our brain is primarily fat. So humans evolved because of the nutritional value that comes best from animal products. We became plant-based when we gave up nutritional health for food security. But that is not how we evolved to be human. And in the modern era, carbohydrates are no longer used as food. They have become a drug we use in excess as a form of dysfunctional emotion management. In 2022, Carbophilia and lipophobia, oh my God, don't eat fat, it's going to kill you. But have as many carbohydrates as you want to. In 2022, we as a society are only happy when we're high. Obese and diabetic people are doing carbohydrates as a drug all the time. But carbohydrates are not necessary for human survival. Sugar and starch are drugs we use to obliterate our emotional tension. And these drugs have devastating mental and physical health consequences. Chronic excessive carbohydrate causes hyperglycemia, insulin resistance, hyperinsulinemia, and every one of the diseases you can see in this metabolic syndrome man. Think of this, folks. There is no human disease caused by deficiency of carbohydrate consumption, but many diseases caused by carbohydrate excess. So now we're fat and we're sick and we're going to use a diet. Well, the methodology that diets use are designed not to be sustainable. Diets use deprivation. I'm not allowed to eat this, I'm not allowed to eat that. Diets use deprivation. Addiction starts with a choice. This is disgusting, he said as he crumpled up his cigarettes and chose to throw them away. That is empowerment. Addiction management starts with a personal choice not to do something, and it's ownership of the fact that you've lost control of that relationship, and you are empowered by the choice you make to crumple that up and throw it away. Oh, I'm fat, I need to go on a diet, I'm not allowed to eat bread, I'm not. Diets mandate control. They ask you to control your carbohydrate consumption. You can have a little bit, but not a lot. Well, name any addiction. Name any addiction where just a little bit is okay. Just one beer, just one light cigarette. Diets require control of substances and calories. Addiction is about relationships. The carbohydrates and alcohol are not a problem. Carbohydrates and alcohol are not a problem. Opioids are not a problem. As a surgeon, I use opioids every day for pain. The problem is a heroin addict, a fat person, an alcoholic's relationship with the drug. Addiction is about relationships, not the substance. Ownership requires acceptance of the absence of control, and therefore if I cannot control my relationship, I have to protect myself by distancing myself from that drug. Diets give you permission to have a little bit and then ask you to control that little bit. Addiction by definition is about the knowledge that you cannot grant yourself permission. Because once you cross the threshold of permission, that is the slippery slope. So they're quantifiably opposite. Diets are gray zones. Addiction is binary. You either did or you didn't. It doesn't matter whether an alcoholic becomes drunk or not. It matters that they give themselves permission to have that first sip of beer. The same is true for carbohydrate addiction. It's the first bite of the cake that matters because you're granting yourself permission to get high. Addiction management requires removal and replacement. Diets require control and reduction. So the conventional keto diet strategy is carbohydrate deprivation. I'm keto, I'm giving up my carbohydrates. I start today and I go on a ketogenic diet and the honeymoon is beautiful. We lose weight, we get healthy for a while. But when we give up carbohydrates and return to a more nutritional form of eating, if you look in a fat person's emotion management toolkit, there's carbohydrates and cobwebs. You get rid of the carbohydrates, now you're sitting with emotional deprivation when the carbohydrates are removed. You're still working hard, life is still coming at you, you're still dopamine loading, but now you don't have any form of emotional relief. You don't have any weapon against your emotional tension. You are serotonin deprived. And when life throws a curveball, an unexpected curveball at you, cobwebs are not a very effective way to deal with it. So boom, we go straight back to crystal meth. We go straight back to carbohydrates. Or the successful smoker now starts to eat more and gains weight. Ketogenic intermittent fasting diets fail 98% of the time, like all other diets. Even surgery, bariatric surgery, fails 85+% of the time because diets are intentionally deprivational. Think of this, folks. If Atkins worked long term, the keto diet would not exist. Everybody did great on Atkins and everybody failed Atkins because removal without replacement of the emotion management components sets up relapse under emotional duress. And excessive carbohydrate consumption is a form of slow suicide, biologically and psychologically. I know the biology, I see the psychology. You probably see the psychology and have a rudimentary understanding of the biology. But 90% of people who die by suicide have a diagnosable and treatable psychiatric disorder at the time of their death. But we don't look at the cry for help that carbohydrate addicts are resoundingly shouting at us. We put them on a darn diet. The majority of diseases we doctors treat with medication are the consequence of our mismanaging our self-esteem, our self-confidence with addictive substances to prop up what we can't generate within. Harmful behaviors and drugs, because as a society, we have forgotten how to parent. So think about this. How often do you not see a patient who has a substance abuse problem, recognized or unrecognized, and how often do you not prescribe psychotropic drugs, antidepressants, or anxiolytic medication to treat carbohydrate addiction? I'm not going to go through the brown, the SSRIs, and the other medications, and the wonderful happy pink turd. You see, weight management is about calories and pounds and kilos. It's about weight loss, reducing calories, and the objective is the scale. And in the ketogenic diet, we're just using carbohydrates as part of an elimination diet, as part of a source of caloric reduction. Obesity management, folks, is not about weight. It's about cognitive behavioral change and recognizing carbohydrates as a drug and yourself as a drug addict. You can outsource weight loss to any diet, surgery, or exercise program, but you cannot outsource obesity. Obesity is a substance abuse problem, and only the person themselves can address their addiction. And it's progressive. Carbohydrates are not the problem, it's your relationship with them that is. And treating carbohydrate addiction has to start with contemplating the surrender of your love affair with a drug called carbohydrates that is trying to kill you. Chronic excessive carbohydrate consumption hijacks the brain and controls emotions, motivation, and mood. Carbohydrates replace healthy dopamine serotonin cycling, and without carbohydrates, the abuser loses motivation, feels sad or depressed, and is unable to function normally both physically and mentally. That's what happens on a ketogenic diet. We feel great for a little while, but then this happens. Addicts need a regular fix to get through their day. Happiness becomes absent and unattainable, resulting in chronic unrelieved depression, anxiety, and stress. Yes, for the first few months, the keto person is happy, happy, happy. But unless they vicariously find and develop effort-based emotion management systems, they're just a relapse away, an unexpected emotion event away from relapse. But the goal of addiction treatment is to restore healthy dopamine serotonin cycling. Addiction management is very simple. There's two parts to it. Number one, break the bad habit. But every bad habit initially had a healthy, a beneficial component to it. You cannot break a habit while you're still doing it. You can only break a habit over time by not doing it. So it requires abstinence. It requires removal to the point of abstinence. But secondarily, that habit had a beneficial role. So therefore, you have to consciously force yourself to replace the beneficial role of those carbohydrates with an effort-based self-care strategy as an alternative, as a new fortress of solitude that may be a walk, it may be building a puzzle or playing a musical instrument, it may be a spiritual relationship or a relationship with another human being, to replace that as a source of emotional solitude, to replace the fridge and the pantry as your fortress of emotional reprieve. And the objective in addiction management is to slowly deprescribe carbohydrates, weaning them by category over time to complete abstinence. Carbohydrate withdrawal is a therapeutic prescription to remission so that keto becomes a lifestyle. It's not just a diet to lose weight. When we use a dietary methodology, even with keto in a keto diet, carbohydrates are focused on as the issue. We asked for tight control. We allow treats. It is done all at once. You're not allowed to eat carbohydrates. Boom, everything's gone at once. There are many, many little goals and measurables, and you can allow these categories. You can have this many grams and that. Nobody can live that way. And the outcome is the measure of success. The goal is weight loss. The goal is to be free of diabetes. Then what? Eat when you're hungry. That's like telling a smoker to have a cigarette when they want to smoke, when they need emotional reprieve. They give us healthy snacks. The intermittent fasting, you cannot eat for these hours. It's forced. It's deprivational. So what do people do? They cheat. There's negative vigilance. Not allowed to have this. I'm not allowed to have that. I'm not allowed to have that. I must eat this because it's healthy. I must eat that because it's healthy. The rigidity and the strictness of the rules clutters you with too much structure that is unsustainable. A keto diet is something you do to lose weight. It is a physical thing. It's a physical thing. It's a physical thing. And ketogenic diets are designed to treat bad outcomes, obesity and diabetes. Whereas addiction management recognizes that it's our relationship with carbohydrates, and we choose to relinquish that from a position of empowerment because we know that we want to change and we don't have control. But it becomes binary. There's never, ever, ever a valid reason for an alcoholic to have a drink, and there's never, ever, ever a valid reason for a fat person to have a carbohydrate. There is a stepwise change. Prochaska, most of you know that. Changing for good, contemplation, preparation, action, and then dealing with relapses. I don't like the word maintenance. It requires lifelong habitual change toward health and happiness, toward generating health and happiness from within rather than external substance. Yes, it does require scheduled eating because hunger is part of process addiction. It requires not snacking, but developing a relationship with a bridge. Instead of nicotine, you chew gum. Instead of a Coke or M&Ms, you drink some coffee or some water or a Diet Coke. A bridge gets you across the need for a snack without causing caloric harm. Intermittent fasting happens when you're no longer triggering hunger every 5 minutes based on emotional need. Intermittent fasting is intrinsic, not extrinsic to the process. It's about removal and replacement and arrogant empowerment. A vegan is not deprived of meat. That's disgusting. How can you kill Bambi? In the same way, a carb addict is not deprived of pizza. That's disgusting. How can anyone eat that? There are boundaries, rigid boundaries, but huge selection of what can I eat. And if you're most focused on what you can eat, then it doesn't matter about what you can't eat. This has to become a way of life if it's sustainable. It's about who you become, it's about what you become, and how you value yourself. It's about a mindful change. And addiction management treats the root cause. Addiction management treats and changes your emotion management system. So if you're going to treat carbohydrate addiction, it requires removal of carbohydrates and replacement with an effort-based emotion management system. The effort to dissipate the emotional tension and time every day to create that meditative space to connect with and process issues causing the emotional tension. Frequent moments of self-approval, self-pride to build a sense of self, to build health, happiness, and weight loss, not as objectives, but as milestones along a journey that has no end. But remember, in addiction management, quitting carbohydrates is like quitting smoking. You suck to begin with. It's always a terrible way to start. And it's seldom sustained the first time. Nobody quits the first time. But the smoker requits and requits and requits until they get it. The fat person, this diet didn't work, this diet didn't work, this diet didn't work. So they bounce from diet to diet to diet that doesn't work. No. Obesity is about relinquishing your relationship with carbohydrates over and over and over again, just like an alcoholic or a smoker does. And eventually, after several relapses and greater humility but greater experience, it becomes a permanent form of change. But in order to help our patients, we have to understand how habits are broken and new ones created. We have to understand the concept of rigid boundaries with choices. We have to understand that our permissive patients require external structure, assistance from other people to sustain the effort, while our authoritarian patients need to relinquish their perfectionism and develop a sense of self-compassion, loving the effort irrespective of outcome rather than because of outcome, and developing a sense of pride and praise for the effort, not the outcome, and returning our locus of validation to ourselves. Because what we're looking for is wholehearted living. And while, yes, we can eat plants, we can eat animals, we need to eat more fat, we have intermittent fasting, we eat sequentially, we don't eat carbohydrates, we use bridges as drinks, not snacks, endorphin time, assigned self-care time, is the key to success, not the diet. And borrowed from Brené Brown, the transformation that the addict wants to undergo and the gift of imperfection is to cultivate during this process, with help from the therapist, to cultivate authenticity and let go of what people think. Let go of that external locus of validation and develop an internal one. Cultivate self-compassion, let go of perfectionism. Cultivate resilience, a resilient spirit, and let go of anger, frustration, numbing, and powerlessness as a way of life. Cultivate gratitude and joy. Let go of scarcity and fear of the dark. Cultivate intuition and trust your faith. Let go of the need for certainty. Cultivate creativity and let go of comparison. Cultivate play and rest. Let go of exhaustion as a status symbol and productivity as a sense of self-worth. Cultivate calmness, stillness, and pleasure. And let go of anxiety as a lifestyle. Cultivate meaningful work. Let go of self-doubt and supposed to. Laughter and song and dance. Letting go of being cool and always being in control. You see, we have to learn that the opposite of too little is not too much. The opposite of too little is enough. And a close friend of mine, Richard Margolis, who's a child psychiatrist, and I came up as a psychiatrist and surgeon with affirmations for our patients. And the affirmations go as follows. Carbohydrates are highly, highly addictive neuroactive drugs that create instant euphoria and tranquility, followed by negativity, guilt, harm, and repression. I have an unhealthy relationship with carbohydrates. I own that. My goal is abstinence. I choose that. I am not on a punitive temporary diet. I enjoy a full menu of healthy, real foods from the land and the oceans. I have a prepared, preemptive plan for the real food I harvest that I buy in supermarkets and restaurants or eat with friends and relatives or on trips and vacations. I'm not surprised by these events. I'm not looking for perfection. I'm looking for forward movement. I'm looking for change and progression. When I make a mistake, I don't beat myself up. I use ownership. I own the mistake. I objectify it. I analyze why it happened, and I come up with a CAPA, a corrective action plan, so that the next time I don't repeat the same mistake. I may stumble, but I always bounce back because change is ever present in my life. I have a plan for emotional buoyancy and resilience. I take pride in the effort I put forth, irrespective of outcome. I create meditative spaces to process my emotions without harm or shame. I practice healthy habits that I substitute for my old unhealthy habits. And I am good enough. I expect gratitude and I show kindness to myself and others in every way, every day. And all of you know this. This is the Carb Addict's prayer, borrowed and modified. Grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. Living one day at a time, enjoying one moment at a time, accepting hardships as the pathway to improvement, taking this imperfect world as it is, not as I would have it, trusting that good enough is good enough if the effort is put forth, that I may be reasonably happy in this life and content with my assets, mind, body, soul, and circumstance. Folks, you can only find perfect happiness when you become content with imperfection. The greatest glory in living lies not in never falling, but in rising every time we fall. I am the Carb Addiction Doc. I hope this has changed your strategic thought process, changed your approach to yourself and other people around you, and I hope I've made you think. Thank you.